So, hello, I'm here today to talk to you about how to hand express. I thought I might start off with some reasons why mums might hand express. So they might hand express, say if they're expressing colostrum antenatally, then they might do some hand expressing. When a mum's milk comes in, her breasts are feeling quite full, and as a result, it's difficult for her baby to attach on. She might do hand expressing for a few minutes just to soften her breast and then make it more easy for a baby to attach on. She might hand express, say there are problems with how well a baby is removing milk in the early days after a baby's born, or the baby's not feeding frequently enough. She might choose to hand express in those early days. Also, if a mum is using a breast pump and she wants to maximise how much milk she can remove when using a breast pump, she might follow up after using a breast pump with a few minutes of hand expressing to maximise how much milk she's removing from her breast. So now we'll just go through the steps to hand express on this knitted breast before we try it on you. When hand expressing, you'd make a C shape with your thumb and fingers, and then you'd place your thumb and fingers about an inch away from your areola. Of course, it depends on how big your areola is. And then what we do is we push in towards the back of your breast, then squeeze your fingers together and then relax. A nice way, easy way to remember that is what Jane Morton from the Stanford University, she has a video on hand expressing, and she talks about press, compress, relax. Press, compress, relax. Now, typically with hand expressing, it can take a minute or so of doing this before you start to see milk. And that's quite normal because, say, when a baby's feeding, it's normal for milk to they're not getting milk straight away. It can take a little while until the letdown reflex or what's called the milk ejection reflex to occur. And then when the milk appears and the baby starts swallowing. So perhaps what we'll do now is I'll show you on you how to hand express.
Both out.
I think so.
Okay, I'm going to roll it down.
Excellent. So perhaps I'll show you, and then if you'd like to have a go perhaps once I've got the milk flowing. Mm-hmm. So again, just making a C shape with my fingers, and sorry if my fingers are a little bit cold. So a little bit, about an inch away from your areola, and then I'm pushing back, rolling. Milk's appearing straight away with you, so we could get this cup here to perhaps collect. So you want to hold that for me, and yeah, so with you, milk is appearing straight away. Also notice with you that the milk that's coming out is mature breast milk, okay? So your baby's more than a few days old, and so it's normal, therefore, that you'd be getting this colour milk. We might even notice, if I work my hands around a little bit, to just target different lobes and milk ducts in your breast, that we might even see a spray. There we go. But in the early days, we wouldn't expect to see that. We'd expect to see smaller volumes of milk come out, perhaps no sprays, and a thicker coloured, more yellow substance called colostrum coming out. So you'll notice here that you can work your fingers around. It doesn't have to be one specific place, and just to target those, as I said, the different lobes and ducts. It's also not a bad idea, let's just move the cup to the other side, to alternate breasts, just to mimic what a baby would usually do when they're breastfeeding, because it's a normal part of breastfeeding for babies to have rest periods where they're not swallowing, and so by alternating breasts, you're kind of mimicking what a baby would normally do. Do you like to have a go?
Yeah. So, can't really do the same position that you were.
Yep. Doesn't matter at all.
So, C-shape, press back.
Yep. Excellent. Okay, I want to try the other side.
Might be easier to.
Yep. There we go. There we go.
But I can't actually see it's coming out until it drips into the cup.
I can see it. That's it. Well done. So does that all make sense in terms of hand expressing? One thing that I could also add is that milk seemed to flow quite easily when we started hand expressing from you, but that doesn't always happen. And one thing that can help is if there was a bit of warmth or massage done to the breast just prior to hand expressing. So for some mums, they'll do some gentle breast massage with like this just for a minute or so just before trying to hand express, and that can help to assist with the milk flowing once you start hand expressing. Or some mums will use a warm wet face washer or a wheat bag, something like that, just for a minute or so prior to hand expressing to try and assist with the milk flow.